everyone, I'm Dr. Fulu and we'll be talking today about a few guiding principles that will help you to establish complementary feeding properly for your baby. Complementary feeding, or the concept of complementary feeding, is defined by a period whereby from 6 months of life, the baby is introduced to the normal family diet. And this is supposed to be a phased procedure. It's not done all at once, it's done in phases, and the baby is more likely to accept this if it is done properly. Now, the first I'll be discussing is the concept of exclusive breastfeeding. So proper complementary feeding will be established if breastfeeding is carried out exclusively from birth to throughout the first 6 months of life. And this means that the baby is given only breast milk to the exclusion of every other thing, including water or medications, except those that are prescribed by the healthcare provider to the baby. And the baby is given on-demand breastfeeding. So this means that whenever the baby cries or shows some sign of discomfort, the baby is given breast milk, and this is done up until 6 months of life. The second is responsive feeding. Now, responsive feeding means that the caregiver identifies where the baby is fed, how the baby is fed, when the baby is fed, how the baby is fed, and all these are done in a way that promotes acceptability of the feeds. Indeed, the caregiver, him or herself, must be assessed. So the caregiver has to be a patient person who is extremely observant and who is able to pick cues that the baby gives. I mean, these definitely will be non-verbal cues, but the caregiver has to be observant to the extent that he or she identifies how the baby responds even to the food that is given. So the food has to be given at the time that is appropriate, meaning when the baby is hungry. It must be presented in a manner that is acceptable, both aesthetically and even temperature-wise. The food must be given at the right temperature, and the food must be given in a manner that is not aggressive or controlling to the baby, such that the baby does not respond in a rebellious manner even to the food. The next principle we'll be discussing is that of hygiene and handling the meals. The baby is still very young at that time, from 6 months to a year of life, and these babies are susceptible to infection. So it is important that their meals are kept hygienically. The handlers must have well-washed hands at all times to ensure that infections are not transmitted to the baby. Any food that has not been consumed must be discarded and not kept, because keeping it and trying to refeed later will promote the risk of transmitting infection even to the baby. Another principle of complementary feeding that will help the baby to accept properly and to grow properly is that food should be increased in quantity gradually. Now, this means that the amount of feed that a baby is given at 6 months definitely shouldn't be the amount of feed that the baby is given at 6.5 months or even at 7 months. So consistently, there must be gradual increase in the amount of food that the baby is given. And this presupposes that feeds must be measured. They shouldn't be given randomly. So if you start with, say, 2 spoons, then gradually you increase to 2.5 and 3 and so on until as the baby grows, so that the baby's feed will be commensurate with the growing size of the baby. The baby's feed should also be increased in consistency, and this means that from a more liquid food substance, which we start with at 6 months, of course starting from breast milk, which is fully fluid, the initial introduction of food should be just a slight thickening from breast milk, and then gradually it is increased in consistency. The baby's swallowing reflexes must be well developed to be able to attempt to swallow food that is very thick in consistency, and this is the reason why we start from a liquid substance and increase consistency gradually until the baby is able to masticate and chew and then swallow very, very thick substances, food substances. Now, the next principle of complementary feeding that we'll be discussing is that of increasing the frequency of feeds. So when it comes to complementary feeding, we shouldn't stick with the accepted 3 meals a day that adults take, because babies need to take more frequently than that. So, of course, breastfeeding continues throughout the period of complementary feeding. So, in addition to breastfeeding, there should be times for the complementary feed, and these times should be increased gradually. So, say for instance, we start with 2 extra meals apart from breast milk. Gradually, from 6 months, we increase to 3 and go on until the baby gets to somewhere about 6 to 8 meals in a day. And these meals must be nutrient dense, because the quantity is not likely to be very much. Now, the next principle is that of dietary diversity. Growing infants need a diverse diet. So gradually, new meals are introduced, and this should be done one at a time, really. There shouldn't be a rush to introduce various kinds of meals, to the growing child. The benefits of doing it slowly are that, first of all, the child is able to learn to accept one particular food type at a time, and then the child is where the carer is also able to identify if there are any meals that cause particular disturbance to a child, such as an upset tummy or even an allergy, and this is identified quickly and removed from the child's meal. So increasing diversity gradually, is very important. Then when children are ill, the fluid intake should be increased. Usually, children do not eat, they have a reduction in their appetite during periods of illness. But these periods of illness sometimes will come with increased fluid losses, such as through diarrhea or vomiting, or even through insensible loss if there's an increase in temperature, like in a child having a fever. So there will be more insensible loss, sweating, and loss from the lungs. So the fluid intake for that child needs to be increased as well. At that point, it might not be very practicable to increase the quantity of feeds, again because of the loss of appetite, but fluids should be monitored closely at that time and definitely increased. Because of the fact that the size of the baby's stomach is quite small, and we've identified that to correct for that, we need to increase the frequency and the consistency of meals. We also need to identify food supplements that might not be in enough quantity in the foods that the baby is given, and supplement for them and fortify, either through fortification of feeds or even through addition of supplements such as vitamin C, vitamin B, and other complex vitamins and micronutrients. This might be we might need to correct this by the use of medications such as multivitamins for the child. Now, if all these are carried out properly, then the period of complementary breastfeeding is likely to be a fulfilling period where the baby will grow adequately, and be able to transit to the normal adult diet without any problems. Thank you.